Siamo a Roma per la terza edizione del BEMS, Best Evidence in Multiple Sclerosis, un evento sostenuto da un educational grant di Teva che riunisce molti dei più importanti specialisti italiani nella sclerosi multipla. Un'occasione importante anche per fare il punto con l'azienda sul suo impegno nella ricerca, sul suo impegno appunto sui farmaci cosiddetti brand. E ne parliamo col dottor Puech l'amministratore delegato di Teva Italia.
Dottor Dalissac è un francese sbarcato in Italia da poco, quindi per agevolarlo parliamo inglese, così lo parleremo un po' come viene tutti e due. Allora, Mr. Dalissac, everybody knows Teva as a company involved in generic and in biosimilar research and development and commercialization. It's less known the involvement in the branded product. Could you please tell us why Teva is involved in this area?
Yeah, grazie mille per la domanda. It's true that Teva has been firstly known in Italy because of the development of generic business, and Teva is a leader of the generic business. But for many years, since the middle of the 70s, Teva started to invest also on research on original product. And the first therapeutic area where Teva has been investing has been the multiple sclerosis. And after development which has been done also with the Weizmann Institute, we have been able to put on the market a product which is today the most widely used product in multiple sclerosis. Today, more than 2 million patients are taking our product daily.
But your research is going ahead, and you are also another product in the pipeline, which is very important for your company. Could you please tell us something about laquinimod, please?
Yes, laquinimod is a new product that we have been also developing by Teva, trying to break the paradigm regarding multiple sclerosis. In the past, multiple sclerosis was a product effect was based mostly on one characteristic, which is the number of failure per year of the product. Today, of seizure per product per year. And with laquinimod, we have been developing a product which is slowing down the progression of the disease. And this is really something new compared to all the products which are currently available to treat the patient suffering from multiple sclerosis.
And when you plan to put this product on the market?
We plan this will be done as soon as we'll get the authorization from the European authorities, and this is on the way.
Multiple sclerosis is not the only area in which you are involved in terms of research. There are other, for example, oncology. And so if you could tell us something about this new area for you.
This is true. Teva is also investing in fact, in 4 therapeutic areas in terms of research. So we discussed about the multiple sclerosis, but in the central nervous system, we are also involved in the Huntington disease, as well as in neuropathic pain. In oncology, to answer to your question, we are today a product under development for the prostate cancer, and maybe tomorrow for the lung cancer, where the demand is very, very strong. We are also investing in research in RESPI, and in RESPI today, especially respiratory. Today in respiratory, the patients which are suffering from asthma, the main problem with the patient today is the compliance. They do not they do not use their product as much as they should, and the interest of the development of Teva is to improve the compliance of the patient vis-à-vis the treatment.
Yes, two words in final for the clinical research activity of Teva in our country.
Thank you for your question again, because Italy has been always a very important country for the development of Teva in terms of clinical research. Not only for the multiple sclerosis, but also for other diseases. Today, we have more than 30 studies ongoing in Italy, which means 2 things. First of all, that the Italian scientific community is well recognized in the world by the quality of its researcher, and something which is really, really known and that people need to understand. We have to be proud of the quality of our people at the hospital level or at the university level. They really are able to deliver good work which is recognized globally. and at the same time, they not only are able to deliver good research, but are able also to give input on the research. So they not only they do what we ask them to do, but at the same time, they also have an added value and making us better understanding what we are doing and the research we are doing here in Italy.